Hi, I'm Dr. Scott Greenberg from Greenberg Regenerative Medicine, and many of you have asked me, would you mind showing me that way of repositioning my shoulder or shoulder blade? And I'm here to show you a demonstration, and it's something that may help you relieve some stress and discomfort, whether it's in your shoulder or neck. So before I actually show you the maneuvers, it's really important to know what's going on. Now, I usually check when I examine patients from behind to look at the level of their shoulder blades. And typically in some patients, the left shoulder blade may go up, the right shoulder blade might go down. Occasionally we see it opposite, or sometimes maybe one shoulder blade is out. But again, try to see if you can look in the mirror and see if you're standing straight like I am, or perhaps you're standing like this with a shoulder out of place. And now I'm going to show you how to reposition your shoulder blades, which again should help with tension in the neck or shoulders. So what we need to make this happen, besides a mirror to look at yourself in order to see if your shoulders are out of place, is a door frame and a cabinet. So with the door frame, what we're going to do is we're going to adjust the shoulder that's higher up. So if we see ourselves like this, it means generally that the trap muscle is contracted, and I'm going to show you a technique to relax it. So what we're going to do is we're going to stand sideways, and we're going to put our hand against the door. We're going to keep our arm at a 90-degree angle and try to keep it parallel with the level of our shoulder. And we're going to push into the door frame. And we're going to push at a position like this where our arm is forward. We're going to push at a position like this where our arm is equal to the shoulder blade. And then we're going to kind of sneak our elbow through the door, and we're going to push again. And apply pressure for about 2 seconds or so for each position, keeping the elbow stable. And what generally will happen is someone's shoulder blade's up here. It'll help to relax that muscle and bring it back to here. Now, conversely, if the shoulder blade is down here and your arm's down like this, we want to lift it up. And the way that we're going to do this is by a maneuver that's similar but different. And we're going to need the cabinet here. So with the cabinet, we want to basically get down to where we're at the level to where our arm again is parallel, but our arm is down. And we're going to apply pressure with our hand into the cabinet this way. We're going to move and apply pressure down this way. And then we're going to apply pressure down again at this angle. And this is to help to elevate the shoulder blade back into place. So if the patient is down like this, often after going through this procedure, they might feel a pop, and the shoulder blade will hopefully get back into place. And we think that these procedures can be helpful to provide even some temporary relief for you while you're trying to get healed. And this is a great tip to pass on to friends if they get a kink in their neck or a pull in their shoulder, or sometimes even some forms of headaches may be able to be helped by this technique and offer some immediate relief. And if you have any questions, please feel free to contact us at Greenberg Regenerative Medicine.